Thank you very much. Again, just a brief background on me and what I do. I've spent most of my career working in the HIPAA area, which there's definitely overlap with HIPAA and SAMHSA. Obviously, HIPAA is a very robust law in of itself, as is the SAMHSA regulations. Although we're only talking about, in the parlance of this webinar, the privacy and security aspects of both laws, because that's what applies to us as practice managers or hospitals, medical practices dealing with protected health information, and also under the SAMHSA aspect, more specifically substance abuse records. And we'll talk about a little bit of background on each law, especially on SAMHSA, as it's a little not quite as well known as HIPAA. So we'll spend a good bit of time on sort of what it is, why it's there. And then obviously we're going to compare and contrast the laws. When does each apply? When do they both apply? When does just SAMHSA apply? When does just HIPAA apply? I've conducted throughout my career, probably over 1,000 risk analysis for healthcare entities as well as business associates throughout my career, of all shapes and sizes, very large hospitals down to tiny little clinics, outpatient facilities, nursing homes, insurance plans, clearinghouses, pretty much anything dealing on the covered entity aspect of this law. And also, business associates, which there are roughly 7 million in this country, many more business associates than there are covered entities, and that would be, an outsourced medical billing company, outsourced IT groups, even data centers that host backups of protected health information, tiny little businesses developing an app for an iPhone that need to be vetted for HIPAA, or if they're working with substance abuse records, we need to look at the SAMHSA considerations with things like that. So there's not a whole lot I haven't seen, and most of what we deal with in healthcare falls under HIPAA. Pretty much anything that any group that is deemed a Part 2 organization typically going to also be under HIPAA. So it's important to understand that a group has to be pretty much under HIPAA, not necessarily SAMHSA. That depends on if you're taking in under the federal programs dealing with substance abuse. Another thing I want to talk about as well is litigation. We're going to talk a little bit about that because these days, especially under the HIPAA regulations, what happened in late 2013 when the final HIPAA omnibus rule came out is the federal government, although there is no private remedy under the federal HIPAA law, the federal government told all 50 attorney generals in the state to implement laws of remedy under the state for an individual who's had their health information violated by a covered entity or a business associate, especially if neglect was involved. So that's becoming a pretty big deal. A lot of trial attorneys have picked up on this. The same basic concept applies to SAMHSA, although no one's suing under the federal SAMHSA regulation. That is a federal law. That violation in of itself, not only from what the government's going to be auditing us and fining us for, but the individual would have a right of remedy under the state law of negligence, invasion of privacy, using the federal violation for that foundation. This is becoming more and more and more common, so extremely important that we talk about this to get our compliance in order prior to something bad happening. And neither one of these, to be honest with you, are rocket science. I mean, when we talk about HIPAA, for example, there's just a lot of best practices, best business practices, best technological practices, best administrative practices, meaning who are we hiring, who are we giving access to this, physical security practices. So definitely a lot of common sense, but this stuff has to be in writing. We have to have policy in writing about this. We have to prove we've done our risk analysis, and that's specifically required under HIPAA. Now, I recommend also doing a risk review / risk analysis for SAMHSA against your organization to make sure we're complying with that, even though there isn't necessarily a federal regulation that requires we do that, but that's the best way to sort of find where the problems are and how to get it best mitigated. So sort of if you're a HIPAA group, obviously, and you also fall under the Part 2 regulations of SAMHSA, you need to include that in your general risk analysis of the organization, include the specifics to SAMHSA, and of course all of the aspects of HIPAA. That goes without saying. So enough of the introduction, and let's get started with this because we have a good bit of slides, and there tends to be a lot of questions at the end of these, especially in this specific webinar relating to these two regulations. So we'll try to wrap this up a little before the hour-and-a-half mark, so you do have some time for Q&A should you have any for me. So let's begin with talking about SAMHSA. Let's jump into what is this. And we're going to start from a broad perspective because this law is very, very robust. There's a lot to this law, not just the 42 CFR Part 2, but I mean, we'll segue into that. But this is the acronym for Substance Abuse and Mental Health Services Administration. It's been around quite some time. So the Substance Abuse and Mental Health Services Administration. Now, one thing also, the Part 2, CFR Part 2, deals with substance abuse records. That's what we're talking about. And mental health records, albeit very, very sensitive information, fall more under the HIPAA regulation. So let's talk about the definition. The Substance Abuse and Mental Health Services Administration is the agency within the U.S. Department of Health and Human Services. Now, that's one particular aspect where HIPAA and SAMHSA have something in common. They're both governed under the HHS. Now, HIPAA is enforced under the Office of Civil Rights wing of the HHS because it is a civil right